Police in San Diego County have seen a 55% increase in the number of mental health calls over the last 5 years. These calls require officers to consider the mental state of a person when figuring out how to de-escalate situations that could involve emotional outbursts, aggression, or curious behavior. No easy task. Joining me to talk about the spike in mental health calls and how the issue is being dealt with are Cynthia Burke, Director of SANDAG's Applied Research Division, and Lieutenant Debbie Farah, Coordinator of the San Diego Police Department's Psychiatric Emergency Response Team. Welcome, both of you. Lieutenant, I want to start with you. What are officers seeing on the streets, inside homes, when they're responding to these mental health calls?
Well, we have seen an increase in mental health calls. A typical call would be someone calling 911 stating that either themselves or one of their loved ones wants to commit suicide. So we would respond to that and make it safe for them and determine whether or not it would be appropriate to transport them to a mental health facility for evaluation.
And other than suicidal behavior, what else are you seeing?
We have people calling that are off their medications and are having auditory or visual hallucinations, or they're extremely depressed, or they're asking about a family member that may be acting a little bizarre.
Cynthia, the 4 largest police agencies saw 22,000 mental health related calls last year compared to 14,000 or 13,000 in 2008. What's behind this increase?
It's difficult to give just one reason. Some of the trends that we saw when we asked for feedback was that suicide rates are highest among older individuals. That may come to as a surprise for some people. We have baby boomers aging. We have individuals who are in our jails, about a quarter of which, if not more, have mental health issues. Many people are getting released from jail and prison. We also have the economic situation in the region, which has deteriorated along with other areas of the country, which could cause stress. San Diego's a military town. We have individuals coming back from war situations with PTSD potentially. I think there's a number of different factors, but the issue that's been around for a number of years, which I think has continued to get worse, is that we don't have the preventative care that we could in the way that would be ideal, which allows for law enforcement to have to respond to these crisis situations. It escalates to that point where could we have prevented that earlier on.
I want to talk about that in a moment. Are officers the first line of defense in these calls? If so, why? Is it connected to that?
It is, because they're the only number that they can call 24/7 and have someone respond. In the perfect world, if I was having a mental health crisis, I'd call 911 and I'd have a psychiatrist show up at my door. But unfortunately, that's not available. So if someone is in a mental health crisis, the only access they have, even if you call your health provider, what do they always say? If this is a mental health or health emergency, dial 911. I think it would be better for having a crisis response team, because it is a medical issue. It isn't a criminal issue, it's a mental issue. But right now, that's all we have.
Given that that's all you have, what sort of training do officers receive to handle these situations?
Well, we have a couple of additions. We have PERT clinicians, which are licensed clinicians that ride with our officers. So after the officers make the scene safe, they have the education and training to properly find the right care for the person that's in a mental health crisis. And then we offer an academy, a 3-day academy, to teach officers de-escalation techniques, how to make the person that's calling less anxious and more comfortable, to let them know that we're not there to arrest them, we're there to help them and bring them to a mental health facility.
So, Cynthia, building on what the lieutenant said, in a perfect world, what would you like to see? Should these people who officers are responding to, who are in a mental health crisis, should they be entering the healthcare system or the criminal justice system? I know it varies from case to case, but what would you like to see happen?
Well, mental health issues, it's not a crime. And so I definitely think that that is not the ideal way. And we also know that locking people up in jail is expensive, so it's not cost effective for the taxpayers, it's not humane, it's not the ideal situation by any means. I think that we need to continue to have a healthy dialogue about mental health issues, which the County of San Diego is doing, about letting people know there shouldn't be a stigma. I think that we need to have dialogues about ways to encourage people to get diagnoses and get treatment, and again, have people, trained individuals who are able to go out and respond to these situations. We want to maintain public safety at the same time as protecting individual rights, but we need to have that dialogue of how best to do that.
We're going to wrap it up there. Cynthia, Lieutenant, thank you so much for coming on the program.
Thank you.